Surgical site infection. Definition. The infection of a wound can be defined as the invasion of organisms through tissues following a breakdown of local and systemic host defenses, leading to local and systemic presentation. SSI is an infected incised wound or deep organ space. SIRS is the body's systemic response to an infected wound. MODS is the effect that the infection produces systemically. MSOF is the end stage of uncontrolled MODS. SIRS can have any of these two, at least two of these listed below: hyperthermia or hypothermia with the given values, tachycardia and tachypnea, and WBC with the given values. Sepsis is SIRS with a documented infection, while sepsis syndrome is a sepsis with evidence of one or more organ failures. Pathogenesis. Dose of bacterial contamination times the virulence is divided to the resistance of the host patient is equal to the risk of surgical site infection. Risk factors would be obesity, metabolic disease, immunosuppression conditions, colonization of GIT, poor perfusion, FB material, and poor surgical technique. Factors would be host response, virulence, vasculature and health of tissue, presence of dead or foreign tissue, and presence of antibiotic.
SSI assessment. For surgical wound assessment, several scoring systems are employed. A sepsis wound score, Southampton wound grading system. This enables surgical wound healing to be graded according to specific criteria, usually giving a numerical value, thus providing more objective assessment of wound. Types depends on the following classification: depth of wound infection, etiology, time of occurrence, and severity. Depth superficial incisional occurs less than 30 days, skin and subcut tissue, purulent discharge, positive sign of inflammation, incision open and diagnosed by the surgeon. Depth deep incisional occurs 30 days to 1 year. Deep soft tissue purulent discharge not from organ. Deep abscess by reoperation, histology and x-ray. Open and diagnosed by a surgeon. Organ space occurs 30 days to 1 year, involves any part of the organ. Purulent discharge should be drained. Organism should be isolated. Depth abscess should be direct and reoperation, histology and x-ray. Open and diagnosed by the surgeon. classification based on etiology, time, and severity, where the primary acquired from a community or indigenous source, such as that the following are perforated peptic ulcer. Secondary, or the exogenous, acquired from the OT, such as inadequate air infiltration or ward, or from contamination at or after the surgery. Time, early infection present within 30 days of procedure. Intermediate occurs between 1 to 3 months. Late, present greater than 3 months after surgery. Based on the severity, minor wound infection may discharge pus or infected serous fluid, but should not be associated with excessive discomfort, systemic sign, or delay in return home. A major SSI is defined as a wound that either discharges significant quantities of pus spontaneously or needs a secondary procedure to drain it.